Om Shanti, Om Shanti.
Om Shanti, Om Shanti. Shall we begin the session, sir?
Yeah, you can begin, sir.
As you all know, that International Forum for Promoting Homeopathy comprises of homeopathic doctors, lovers, and homeopathic students. We have conducting regular sessions from 7 to 10, 7 to 8 p.m. We have Hindi session, 8 to 9. We have international session in English, and 9 to 10, we have local language session in Malayalam. So we are lucky to have one of the best personality from the homeopathic profession, and that is Professor Dr. Dharmendra Sharma from Homeopathic Medical College, Pembrey. And sir has completed his MD Homeopathy and is a PhD holder and having PGDMLS in his degrees. And sir is the principal and professor and head of the Department of Forensic Medicine and Toxicology, and is the Dean Faculty Homeopathy, DPU, Pembrey, Pune, and a member of Planning Monitoring Board, DPU, and member of the Board of Research and Chairman and Research and Recognition Committee, member Ethics Committee of BDJT Homeopathic Medical College, Dharwad, Karnataka, and a member of Board of Studies in Bharatiya Vidyapith, Pune. So today we are discussing about the new trend in research in homeopathy. As you all know that homeopathy is a big science, but some people say that it is a pseudoscience. But we have and very good people who are there to show the world that homeopathy is the scientific system, and we have a lot of research papers published by homeopathic professionals, particularly our research group, and CCRH is doing a wonderful job. So many private doctors are doing a wonderful job, and our doctors, Dr. Prakash Rao, Dr. Chandraja, Dr. Harlan Cole, and doctors, so many doctors came out in this forum and made a lot of good presentation. So we can expect one of the best presentation from our professor, Dharmendra Sharma, doctor. Yes, sir. We welcome. You can present your presentation now, sir.
Welcome, Dr. Dharmendra Sharma ji.
Thank you,
I'd
sir.
like to
Thank
see
you.
after a long time, and you can
Thank you,
start
sir.
your journey now.
Thank you, sir. Thank you. At the outset, I'd like to thank, sir, can you hear me, sir?
Yes, sir.
Yeah, you are audible, sir. You are audible.
Thank you, Dr. Danesh, for the introduction, and Dr. Sahani for letting me in for this wonderful webinar. I hope that whatever I say has got some, everybody appreciates it. So thank you very much. Without much ado, I'd like to start with my presentation. Kindly allow me to share the screen.
Yes, sir. You can do it, sir.
Sir, is the screen visible to you?
Yes, sir.
Visible, sir. Visible,
Yes, sir. Everything fine.
Okay, sir. So we come to where we start from here is that today's topic was given to me by sir, and we thought that what is a good topic to speak on. So we thought that research, or rather, the new trends in research is our topic for today. And as we all know that there is a lot of criticism still about homeopathy. I passed my BHMS in 1987-88. It's been more than 35 years now, and the questions are still not stopped. There are a lot of skeptics for homeopathy, and people feel that homeopathy is actually, like Dr. Dhanesh just now said, that it's a pseudoscience. But I don't believe, I think otherwise. And that is why I thought that the best way to silence the critics is by showing your good research work. So I'll start with my presentation. Let us, everybody says that there is no evidence that homeopathy works. So I'll start with what is evidence-based research. So if you see, evidence-based research is a systematic and a transparent utility of the earlier findings while conducting a new study so that all the questions are answered with respect to the validity and reliability of the previous study. So this is what evidence-based research actually is. Why is evidence-based research important? Because evidence-based research aims to provide the safe and effective treatment which is easily accessible and helps in improving the condition of the patient. So that is the importance actually of evidence-based research. And then the question arises that what is the meaning of evidence-based research? It is any outcome that is derived from or informed by objective evidence. There are many times we see that there are many patients or rather the practitioners who keep, saying that I cured this patient and I cured HIV and I cured this and I cured that. But individual, people can have individual cases cured, but that does not amount to evidence-based research. There is a systematic methodology which the world believes in. And if we as homeopaths put in all our work through this kind of a systemic research methodology, then only people are going to believe in what homeopathy actually is, and that homeopathy is also an evidence-based medicine. So you see, the basics of evidence-based research is, number one, very important for us is to formulate a research question. A research question is a question which comes to your mind. For example, if I feel that I want to see that what is known as the Keeler's aggravation, in which the patient goes and dies because of the homeopathic medicine. So if this is, I want to know what is this Keeler's aggravation. So that is why that is the research question in my mind. And then I will go through research methodology and try to prove what is my research question, whether it is right or whether it is wrong. So this is one of the basics of evidence-based research. The second is a thorough literature search. If you go back to the literature of homeopathy, which is available to us, we will definitely be able to find out that, there are so many questions in our literature which we need to answer. So that could become one of the basics of evidence-based research. Then next is the critical evaluation of the evidence for validity and reliability. Many of the tenets of homeopathy, we need now with the passing time, we need to validate everything, and we need that this validation should be reliable also. And then we also have the integration of evidence with a clinical expertise. Just one sec. Yeah. And finally, we have to evaluate the final outcomes based on evidence. So how do you assess that your research actually is evidence-based? So number one, research is said to be evidence-based. Research is said to be evidence-based when it has been rigorously evaluated in experimental evaluations like RCTs, what are called as randomized controlled trials. And they are shown to make a positive, statistically significant difference in the outcome. So this is what is about so what are the benefits? When coming to the benefits of evidence-based research, you can see it generates new knowledge. So every evidence-based research will, it will create new knowledge. There will be effective clinical decision-making. It will promote the quality and efficacy of the treatment, and also it will improve the patient outcome measures. And what are the barriers we have for evidence-based research? Number one, we have the mismanagement of time. Then very important is the lack of knowledge. Many of our homeopathic friends do not actually dwell deeply into the subject. What they do is that their knowledge is very superficial, especially about subjects like medicine and surgery and gynecology. And this lack of the understanding of medicine becomes one of the big barriers for evidence-based research. Whatever has been written in our books in the past, we need to prove it in this given time. And that is why the day we start proving everything we say in the formula of the research methodology, then and only then will the people start believing, and the skeptics will start, will not give names to homeopathy. Then next is a lack of motivation. This is very important because all homeopaths need to be motivated. So if you are having a research mind, and if you have the motivation, then and then only we can go in for evidence-based research. Secondly is lack of resources. See, our homeopathic friends are practicing in various parts of the country. Many of the times they are somewhere in the villages, and they do not have the facility of the internet, and they do not have the various facilities for research. So this also becomes a barrier for evidence-based research. Then lack of training. Our earlier courses, if you see the earlier courses in homeopathy, there were many subjects which were not there, which were not taught. For example, there used to be a course called as LCH prior to the BHMS started. And in that subject, there was no repertory subject, just did not exist in the curriculum. So everybody used to read books, and they learned directly from the books. There was a very, the training was lacking in those days. Then you have a shortage of evidence also. So shortage of evidence also can be there. And then also you have the difficulty of finding valid, credible evidence about it. So these are the barriers which we can have for evidence-based research. Now, how do you decide that the source is evidence-based? Whatever you are doing, it is evidence-based. How do you decide it? So number one is the articles which are published in peer-reviewed index journals have been thorough in a rigorous review before being published, because these articles have been gone through the review process. The articles in peer-reviewed journals are good sources of evidence-based articles. You have different databases like the Scopus, you have the PubMed, you have the Web of Science. These all can be good evidence-based sources. Now, I'll tell you just one small thing that recently, when our college went in for the accreditation by the NAC, so research has got a big value in giving you points in the NAC accreditation. At that time, we realized that there are very few homeopathic journals which are included in the Scopus database, because NAC will not calculate National Journal of Homeopathy. They will not calculate Homeo Times. They will not calculate any of these homeopathy for all. All these journals are classified by the NAC and by the UGC as predatory journals. And publishing any article in a journal which is not in the Scopus or which is not in the Web of Science doesn't get you any marks anywhere. So that research paper which you have published over there, it does not actually give you any help. So that is why the need that good research publications should be always done in the journals which are indexed only in the Scopus, PubMed, and Web of Science. So this thing, if we all homeopaths start following, soon we will have a good database which will have credible information about homeopathy in them. Now, over here, we classify all the evidence-based studies to be included in literature research. You see the different levels. There are 7 levels. So what is the highest level of evidence which the world believes in? So number 1 is evidence from a systematic review or a meta-analysis of all the relevant RCTs or the randomized controlled trials, or evidence-based clinical practice guidelines based on systemic reviews of the RCTs, or 3 or more RCTs of good quality that have similar results. So unless we get this kind of information, the credibility of your work is not very, very high. So for you to have the highest level of evidence, there should be a meta-analysis of minimum 3 or more RCTs. So unless we have a meta-analysis of that, we are not able to tell the world that our research is having any value. Then coming to level 2, evidence obtained from at least one well-designed RCT. So it will have a little lesser value than 3 RCTs. So 1 RCT, large multi-site RCT, is good enough to give us evidence. Level 3 is evidence obtained from a well-designed controlled trial without randomization. So this is again another way of getting evidence-based studies. Level 4, you see this evidence from well-designed case control or cohort studies. So cohort studies will come to level 4 of an evidence. Level 5 is evidence from systematic reviews of descriptive and qualitative studies or a meta synthesis. So this kind of a, if you have this kind of a research, this thing, you will come in the level 5. Then level 6 is evidence from a single descriptive or a qualitative study. That will come in the level 6. Level 7 is evidence from the opinion of authorities and or reports of expert committees. So a report of authorities and expert committees will be the lowest level of the evidence-based studies. But these are the different 7 levels in which we can say that our work is having some evidence. So the best evidence-based research studies, well-done systematic reviews, meta-analysis provide the best evidence for all question types, as they are based on the findings of multiple studies that were identified in the comprehensive systematic literature search. Whenever we do a literature search and we come across some good systematic reviews, meta-analysis, then these are the best evidence for our multiple studies. Okay, so this is one of the ways for for improving our evidence-based research studies. So the type of research considered to provide the highest quality of evidence, like I told you, is randomized controlled trials are given the highest level because they are designed to be unbiased and have less risk of systematic errors, because always you have a control group. In your research, unless you have a control group and you are doing a clinical trial, there is no use. So when we say in our clinical practice, we say that we have cured so many number of cases, but it doesn't hold much fort, because our work is not having a control along with that. So one group, one arm of our research study should have a control, and the other arm should be the research arm. So that is why the importance of a randomized controlled trial is very, very important. So what is the status of evidence-based research in homeopathy today? So despite the growing popularity and evidence, homeopathy still continues to face criticism in terms of the research being conducted in homeopathy. The following reasons, what I thought I have just put down. Number one, homeopathic research requires more rigorous randomized controlled trials. So we are not doing enough work in this regard. Then secondly, it requires more specific trial methodology. There is something called as a research methodology. So many of our homeopathic friends are not familiar with research methodology, and that is why whenever you go in for a clinical trial, you need to get actually registered with the Control Registry of India, which is called as a CTRI registration. In fact, in my college, all the students of the PG also need to have their research registered with the Control Registry of India before proceeding for their MD dissertation thesis. So also we see that frequently there is a lack in the randomization criteria and the placebo use and laboratory markers. So because of this reasons, our status of evidence-based research is not as good as it should be. Then we also have a lack of use of individualized therapy and specific drug effects on specific pathology. If we do away with this lack of use and start using more specific drug effects in specific pathology in individualized therapies, I'm sure that our evidence-based research will become better. Then we also have a large methodological variability, different aims, different described outcomes, placebo uses. There is no standardization of all these things. Unless we have standardization, our evidence-based research cannot move forward. Also, we have a poor remedy description, multi-variegated symptom collections, and a lack of data analysis. These are the various reasons why our homeopathy is not progressing in the field of research. Also, we have a lack of high quality systematic reviews, and we have very limited qualitative studies, if you see. And also we have a lack of homeopathic journals in the mainstream databases. Like I just told you that in the Scopus or in the Web of Science or in the PubMed, very few homeopathic journals. One journal from the Faculty of Homeopathy, that is Homeopathy, the journal is called Homeopathy now, is having the highest impact factor of 3 point something. So that is a really good journal, which has got a lot of weightage if you publish your research article in that journal. Homeopathic methodology cannot be reflected in the conventional research methodology framework. You see, in allopathy, it is so easy that 100 people are given one drug and 100 people are kept control, and the effect of this one drug on 100 people is tested. But in homeopathy, we cannot do that, because in homeopathy, we have a drug for every patient. So in other words, in allopathy, it is like it is like ready-made clothing. So one fits all. You have the sizes. You have the L, you have XL, you have double XL, and but in homeopathy, it's not like that. In homeopathy, you have to tailorize and tailor make your clothes. So that is why homeopathy is much more difficult to practice than allopathy, because you have to really be a good tailor, take the good symptoms of the patient, and then you are able to prescribe. So the difference between homeopathy and allopathy, as I tell my students, is that it is more of a tailored clothing, and one is like ready-made clothing. So this is the difference, basic difference between the two. So before I proceed now further, I would like to show you some of the evidence-based research which we are doing at our college. So let us have a glance at some of the new trends of research which we have adopted at the D.Y. Patil Vidyapeeth and the D.Y. Patil Homeopathic College and Research Center in Pune for evidence-based research. I am just showing this, I'm just sharing this with all of you so that we get an insight into what are the good things we can all do for homeopathy. So what we have in our college is these are the major research facilities which are available in our college. So you have a central research facility, we have a molecular diagnostic laboratory, we have a regenerative medicine laboratory of microbial diversity, we have an animal cell culture laboratory and an animal hold area. We have medicinal plants and we have an herbal garden, a media laboratory, e-resources studio. We have databases, research, statistical and health informatics, and we also have a clinical trial center. So these are our major research facilities which we have. These are some of the pictures which you can see of our central research facility. This is equipped with the flow cytometer, the confocal microscope, the trinocular microscope, and this laboratory is NABL accredited. These are some of our other facilities. You can see over here, you have the molecular research diagnostic facility. You have the molecular biology lab over here, the laminar air floor, the automated RNA extractor. Then you have over here, down here, the cooling centrifuge, the quant studios, and the conofocal microscope. So what do we do over here? So in our central research facility, we have animal cell culture laboratory for cell-based assays. So here we have in vitro models on which we can do toxicity testing, cancer cell line testing, tissue engineering, angiogenesis studies, drugs and vaccines, and alternative to animals. So this is facilities which we have at our central research laboratory. So it is a state-of-the-art laboratory with you can see over here the pictures which I am sharing with all of you. We have a quality control lab, a cell culture lab, the culture room, the sterility room, media storage, the QC room, and our state of laboratory is GMP certified. It is also licensed to produce the stem cells of clinical grade. It was established in the year 2018, and this research is the highlight of the laboratory, the stem cell research. So we are doing a lot of testing of homeopathic medicines on stem cells. I'll just show you what we have done. So let us have a glimpse at few of the evidence-based researches carried out at our homeopathic medical college. So number one, I'm going to share 3 research papers with you in this short time which is available to us. Number one is that the name of the research was stem cell secretome modulated by Arsenicum album 30C, which ameliorates the lipopolysaccharide induced cytokine storm in the blood mononuclear cells in vitro. So we had all seen that in this COVID, everybody had a really bad time, and everybody was talking about the cytokine storm, which led to death of patients. And you know that the CCRH, or the Central Council of Research in Homeopathy, had said that arsenicum album would be a good medicine for this. And people kept saying that this is arsenic is hocus pocus, it has got no use. So this was our research question, that why not find out in the laboratory whether arsenicum album 30C can work in the case of COVID. So this is the test, this is the project which we took up, and I'm just sharing with you the findings also. Sani sir, am I audible and is everything okay?
Everything perfect, sir.
Okay, thank you, sir. Thank you, sir. So this stem cell secretome modulated by arsenicum album 30C ameliorates the lipopolysaccharide induced cytokine storm in the blood mononuclear cells in vitro. This was an article which is published, and now this article is published in this journal which I was telling you, in Homeopathy Today. The Journal of the Faculty of Homeopathy from Great Britain is the best journal which publishes articles, and this article of ours was selected by the authors of Homeopathy Journal, and it has already been published. It has got a very high impact factor, and we are very thankful to the journal for publishing this article, because out of the 270 homeopathic colleges in India, this is the first college, ours is the first college which has been able to publish a work of high repute in this highly reputed journal. So I'm very happy about this. So I thought I must share this with all of you. So we all know that on 6th of March 2020, the Ministry of Ayush, Government of India, came out with an advisory for COVID-19 pandemic, which said that arsenic album 30 once in empty stomach for 3 days. The dose should be repeated after 1 month, following the same schedule till the coronavirus infections prevail in the community. In one of the studies, arsenicum album as one of the constituents in the formulation affected the HT29 cells and human macrophages. Also, it showed NF-kB activity, hyperactivity, and it also showed that it reduced the TNF release in macrophages. Moreover, arsenicum album is a common prescription in cases which we are using every day in respiratory infections in day-to-day practice. But the exact mechanism of the action of arsenicum album as an immunomodulator was unknown. Therefore, keeping this background in view, the following research project was initiated at our regenerative medicine laboratory at our D.Y. Patil Vidyapeeth in Pune. The aim was to study the immunomodulatory activity of the homeopathic medicine arsenicum album by employing the stem cell model. We all know what stem cells are. So over here, you will see that number one, to observe the action of arsenicum album on these were one of our objectives. So the objective was number one, to observe the action of arsenicum album on the cytokine release through the dental pulp cell mesenchymal stem cells. That is, our stem cells are derived from the dental pulp cells. So here you can see the picture also is there over here on the side. Second objective was to study the cytotoxicity of arsenicum album in 30C in employing the stem cell model. And the last was to provide evidence-based science and confirm the role of arsenicum album as an immunomodulator. So the place of the study was our college. The duration was 1 year. The intervention was arsenicum album 30C on mesenchymal stem cells. You see here a picture which is showing you the mesenchymal stem cells. Here arsenicum album was used. The cell viability assay was done. And then the stem cells, you see here the lymphocytes, you see arsenicum album was given, and you see over here the pro-inflammatory cytokines and the anti-inflammatory cytokines. So you see over here, down over here, that the treatment of acute relapses in multiple sclerosis and etc. This I have taken this reference, and that is why I have made this slide for that. So here again, if you go further, you will see that AA30 exhibited significant decrease in the increase in the proliferation of the cells at a concentration range of 10 to 50%, whereas none of the diluted dose were cytotoxic to the cells as evidenced by the incorporation assay. You see over here the percentage viability of when treated with the arsenicum album at various concentrations. You see here, this is at 50% concentration, this is at 30%, this is at 10. So you see here the levels of pro-inflammatory cytokines were also regulated. So you see over here, these are the different assays which were done. Interestingly, the treatment of arsenicum album 30 resulted in increased levels of anti-inflammatory cytokines. Okay, so the TGF beta and the IL-4 secretion was also regulated and also maintained. This is the pathology of the treatment of COVID. You see over here in vitro it was given, and you see over here the anti-inflammatory cytokines increased and the pro-inflammatory cytokines decreased. Thereby, the cytokine storm was reduced with the use of arsenicum album. So that is how we were able to prove our research question that arsenicum album, as the CCRH had selected this medicine, it was the right medicine which was used. And in spite of all the criticism people did, we were able to prove it in the laboratory that this was the right medicine to have used. Coming to our second research, evidence-based research number 2. This was a project which was called repurposing the anti-angiogenic activity of homeopathic medicines by employing the chick embryo model and in vivo studies. So in these cases, a chick embryo was used and the homeopathic medicines were tested on that. The observations were made and then they were noted down and then they were published. So you see over here that homeopathic medicines have the potential of treatment of patients suffering from cancer, retinopathies, hemorrhagic disorders, where anti-angiogenesis plays a very vital role. So homeopathic medicines have been used to treat hemorrhagic disorders. For example, we always say HOMS to be used in hemorrhages, varicose veins, and venous congestion. Then thalassemia bursa is used in flabby condition of the uterus, hemorrhagic condition, uterine fibroid. This has been said, their mechanism of action actually remains unknown. Therefore, this study was intended to establish the angiogenic and the anti-angiogenic effect of the selected homeopathic medicines employing the chick embryo model. So here you see, this is the repurposing the anti-angiogenic homeopathic medicine in the chick embryo. Now you see here, this is the vehicle control. You see the control over here. So now here we are using HOMS. You see over here, and you see the result over here, the number of blood vessels reduced, which can be clearly visible after using HOMS. Here after using thalassemia bursa, and significant depletion in several secondary blood vessels was observed in the embryos. So when we say that it has got an anti-hemorrhagic tendency, this is the way we can show that when it is used on an egg or an in vivo study, you can show over here that the blood vessels, after using this medicine 200C on the chick embryo, we see that the blood vessels have reduced. So this is what is called as evidence-based research, where it is visible. We are not saying that my patient became okay. We are saying, you look here, in this experiment, we can prove the action of the homeopathic medicine. So the mechanism of action of selected homeopathic medicines as anti-angiogenic is proved, which can be used to combat various diseases like hemorrhages, varicose veins, venous congestion, and problems related to hemorrhagic disorders. This will further help to study the action of these homeopathic medicines as a potential line of treatment in patients who are suffering from cancers, diabetic retinopathies, hemorrhagic disorders, where anti-angiogenesis plays a vital role. So this was the conclusion of this second research work which we had. Coming to the evidence-based research project number 3, anti-adipogenetic activity of the homeopathic preparation of Chelidonium mages employing the 323L1 cell line as a model. So here our research question was, can Chelidonium mages have an anti-obesity, or can it have an anti-diabetic action? So this is what we wanted to prove. So despite the various evidences which suggest the role of homeopathic preparation of Chelidonium in the management of obesity and in diabetes mellitus of type 2, its mode of action still remains unclear. In this study, we investigated the cytotoxicity and the anti-adipogenetic effect of HPCM in the 323L1 cell lines. So over here you see Chelidonium mages has been used on the cell lines. Here you see the control. Here you see the action. The control remains same. Now here we are using chelidonium majus in the 0.5%. And you see over here, the new islet cells are being prepared. So you have the increase in the number of islet cells. That means that it has chelidonium majus, if used, can have the property of improving the islet cells, thereby increasing the secretion of insulin and reducing the diabetes. And after this research was done in my private practice also, I'm using chelidonium in LM potency for most of my cases of diabetes mellitus, and I have brought down the HB1AC from 9 and 10 to 3 and 4. So this is the action of this. So as you see over here in the red staining, the LD accumulation is more in the control than of the medicine which is used, which shows that it has got an anti-adipogenetic activity of homeopathic preparation of chelidonium majus. A significant reduction in the accumulation. Sorry, I'll go back. Yeah. Significant reduction in the accumulation of lipid droplets are seen in 0.5, 1 and 2% concentration in comparison with the control, which shows that the given preparation is anti-adipogenic. Now, this is again something which is showing that our research is evidence-based, and it is not something which we are empirically doing in our clinics and telling the people that homeopathy is working very good. Coming to our last, I think 4 is my last one. So here we are seeing the question was human mesenchymal stem cells derived islets as a model for establishing homeopathic attenuation as an insulin secretor. There we saw the adiposity. Here we are seeing exclusively only the islets. So despite the plethora of evidences suggesting the role of homeopathic medicine in type 2 diabetes, its mode of action remains unclear. Thus, the current study was aimed for the insulin-tropic action of the homeopathic medicines on human umbilical cord mesenchymal cells. They were derived from the islets. Here you see the control. Here you see the islet has grown. Here you see insulinum medicine which was used. Here you see the islets. Here uranium nitricum, Syzygium jambolinum. You see over here the action. So these were the action. You see here the graph is there: control, uranium nitricum, insulinum, and Syzygium jambolinum. You see how the islets got differentiated. So the data, also one very interesting finding we came across is that Syzygium jambolinum, which we are using very commonly, everybody is giving patients to drink continuously. It is toxic at all levels of concentration. So in Syzygium jambolinum medicine has got hepatic toxicity, which, you know, recently some people in Kerala also said that some of the homeopathic medicines are toxic. And we certainly found out that Syzygium jambolinum is got an hepatotoxicity. Insulinum 0/1 was found the most non-toxic in all concentrations, as evident from the above graph, after 48 hours of treatment and exhibited islet differentiation. So this is about this experiment in which we did about diabetes. The work before us, therefore, is to subject homeopathic therapies to an evidence-based scrutiny, so that the best of it gets reinforced for safe and effective use. Such a scrutiny would, of course, first require a demystification of all the homeopathic theories. We know we study so much of organon, but none of what is written in the organon. Okay, Dr. Hahnemann must have seen it, but today the world is saying that, why don't you prove what you say? And evidence-based research is the only answer to silence all these critics. So we need to relook all our books of organon. So all the homeopathic theories, whether it is Kent's 12 observations, whether it is any of these are the fundamental research which all of us need to undertake. And also I feel that the central government bodies are more equipped and they are more having a lot of funds to do such research. So fundamental research in homeopathy is another thing which I feel is on the anvil, which we all must look into. A strict scientific attitude alongside a benevolent, interested traditional knowledge basis are both required in accomplishing this work. This is true for Ayurveda also. Recently, there was an article on Ayurveda also, and I shared that with Sani sir recently. So the traditional homeopathic practitioners, though would have none of it. Despite their irreconcilable differences, they are both agreed on one thing. According to both of them, homeopathic theories and practices do not need any evidence-based appraisal at all, which I find to be absolutely absurd. They need to have evidence-based appraisals now, because see, the younger generation of people are not going to talk or not going to look to all dynamic things. They want everything to be proven, and it is our duty as homeopathic doctors and physicians and researchers to do whatever best we can to bring more evidence to homeopathy. These homeopathic traditionals feel that their texts are too perfect. So everybody says Hahnemann's Organon is perfect, but Hahnemann's Organon was written at a time when science was in the infancy. And although most of his work is 100% right, but there are many loopholes over there, and there are many new things which we can add into that. All science, modern medicine has come from the day of the Lancet to today, the world of the robotic surgeries. And we are still dwelling and we are still talking about our fundamental principles can never change. But there are so many things which can be better explained in the light of the modern medicine which we have. In fact, my PhD thesis was also, the comparing what Hahnemann has said in those days to modern medicine and what are the parallel lines we can draw from there. And it was quite a good work and a lot of heavy work I had done for that PhD. So it must be remembered that the homeopathic classics were authored at least 200 years ago. We are here in the 21st century. We need to acknowledge the deficiencies in them and make good for them by revising our ancient text. A haphazard juxtaposition of ancient speculations alongside current facts and confusingly equalizing the validity of both is a serious problem that has been plaguing homeopathic pedagogy. This approach has made homeopathic students intellectually defrauded, and the new generation is not ready to listen to all the old things. They want everything to be explained in the light of the modern medicine. And we as homeopaths have a responsibility towards that. These are some of the references I have taken. So while lack of evidence is not a good evidence against empirical medical therapies, thousands of dubious treatment modalities roam the human domain with concocted scientific evidence. Whether you agree with the first statement or not, I'm not sure. It's very difficult to disagree with the second one. Let's commit to change this notion about homeopathy today. That would be the audace apparent lived by us in today's times, instead of just remembering it merely as a wonderful statement. Thank you very much. Thank you.
Thank you, Professor Dharmendra Sharma, sir. It's really a wonderful session from you. Really, it shows the relevance or importance of research work, and you people, you being the principal and the head of the department in your college, doing a wonderful work for the profession itself, not only for your college, but even though you are making it for your college, but it is not so. It is for the entire people around the world that homeopathy your work is to prove homeopathy is scientific. This is the kind of work we need to show, because we people, we have no more than 2 lakh homeopathy practitioners, but all are doing wonderful job in treating and curing the patient. But still, we are lacking evidences. We need evidences which need to be published, but in a scientific way. As you pointed out in the presentation, that there are certain deviation in our protocol from the allopathic protocol, but they used to do with the same medicine, same patients, but we same people, but we as as a homeopaths have a different style of approach, that is personal identity or different individuality or like that. But this is the basic thing that we have got from your presentation. Anyway, at the time of pandemic, you have made a wonderful research work on arsenic alcohol. So that's also a very good thing. A lot of people made this kind of work during our pandemic, and all those reports were published. And but what we need to do is that we need to bring all these things to the public. In particularly, we have to translate all of your work into the local language, and we need to reach it to the people, because now people are nowadays common people are not getting any knowledge about this kind of research work. So what I suggest here is that we as a team need to translate into a local language all this research work, and we need to publish in our local newspapers as well as in local channels, so that it will reach more to the people. And that's as you mentioned in the theory, that there is a, as you in your speech you told that some people are commenting about homeopathy in Kerala, but frankly it is not in that way. It is because they want to target homeopathy, because here homeopathy is growing anything like gold rate. This is what is the reason why the people are running and criticizing. They are making cases against homeopathic doctors, because homeopathy has a tremendous growth in Kerala. And nowadays, you can find at least 7 to 10 people in a square kilometer. This is what is the thing that is happening in Kerala. And that is the reason why those people are sitting from the other side, want to target us and want to demolish us. But frankly, even at the time of pandemic, homeopathy growth in Kerala was excellent. So anyway, I congratulate you, sir, once again. So we have the time, we will have some more time to discuss. So what's your opinion on that, sir?
Yeah, absolutely right, sir. You're absolutely right and spot on. And I'm actually really happy to share this with you. And like you rightly said, this needs to go to the common man. And so we'll be happy to translate this work, and I'll get it done. And accordingly, we'll see that in maximum languages, we can publish this work.
Yes, sir. Yes, sir. Now let us invite Dr. T. N. Sridhar, who is the former CCH Assistant Director. So welcome, sir.
Thank you, Dr. DHARMENDRA SHARMA, that your session was excellent, that your research findings are very good. I appreciate you. I like to ask a few questions here, that people are local language and etc. While I was in charge of the Central Research Institute in Kottayam, that I went to different places and different organizations. They are asking why you are not publishing, and Central Council is publishing journals, but it is not to the duty of the government to reach into the every house to house. It is your duty also to find out, and you must have to give that 300 rupees every month, that you will get this journal in your house. But you cannot give like that of newspaper. You cannot give it reach into your house. So I told that they are not knowing what is going on. They asked that, criticizing what CCRH was doing, that see that when you are doing something, you are not concentrating on that only. It is publishing in the journal. It is the duty of the doctor to find out and to that you must have to see that the journal and do it. And that is the researcher's duty, is to find out and publish it. And it is the duty of the doctors or the others who wants to know. They must have to, the organization, they can do it, publish it, and translate it and do it. It is not only the duty of the researchers to publish. Only the publishing is their duty, and rest that is the other bodies, they must have to do it. That what I feel is, don't feel bad. That then another thing that I like to ask, that the fundamental research is so far, since the last 225 years, fundamental research, we are not able to answer for that. It is a big thing that whether you are taking that fundamental research in your hospital. I appreciate, I came to know that your
Yes.
institute, the university is accepted the one Chandran's book also. Your university is accepted. He is from Kannur. That I know him very well personally. I appreciate you, but that what you are doing, whether you are doing something for the fundamental research, evidence-based, I understood.
Yeah.
I can understand.
Sir, it is on the anvil, and we are already taking up some projects. We have also collaborated with the CCRH, and some projects are still going on. And soon I will be able to give you some good news on that respect also.
Okay, it is better, sir, that of course CCRH is having that much fund and
Yes.
providing,
Yes.
and they can help you so much.
Now, sir, recently the CCRH has been very proactive, and they have formulated a group of colleges and good homeopathic doctors who have come together, and so collaborative research is on the anvil. And we have now involved not only the senior faculty and the senior students, but also students right from the first year are involved in research work. So that is how we are planning to take forward this research, and I'm sure in the next 2 to 3 years you will see a big sea change in the research field in homeopathy.
Thank you very much, sir. I
you,
have
sir.
a big thanks and a big salute for you. Please come again and
Thank
in
you,
our
sir.
forum with some
Thank you,
other
sir.
subjects. Thank you very
Thank
much.
you, sir.
God
Thank you,
bless.
sir. Thank
Thank
you,
you.
Yes,
Sir.
as Sridhar Sir pointed out that it is not the duty of the researcher to publish it, but it is the duty of the organizations, and particularly the CCRH can come out with funding for that, because we need in that respect also, because the other side, the allopathic people, they are being funded by the medical pharmas, but as far as homeopathy is concerned, we have no such people to assist us or to make this thing into public. Frankly, even the research work done by CRH on arsenic amalgam didn't reach the public. Actually, there was a 99.8% success rate in that research work, but unfortunately, it didn't came out to the public. And even though it came out, it was very, very late. By the time the vaccine took place, they took the role to control the pandemic, but it got a reverse hit, and everything went down from their hand. Even now, people are searching for arsenic. Nowadays, we have in Kerala the second now some COVID, people are coming up with the COVIDs, but we can easily manage it our homeopathic remedy. I would like to invite Dr. Muhammad Ali. You want to communicate with you, sir?
Thank you, sir. Good evening and Assalamu alaikum. I appreciate forum of IFPH International Forum for Homeopathy, which really good job and doing good work for the promotion of homeopathy globally. Today, I am really very happy to see the research about scientific base proved by of arsenicum album chilidonium, which is a very, very good step for the promotion of homeopathy. And this research, I want to say that should be on social media as well as like YouTube, Telegram, Instagram. And I also inform through this platform about the research of new medicine. I really appreciate your efforts and the forum research. I salute you. Thank you, sir.
Yes. Yes, tomorrow we have another session by Professor Dr. Subhamay Ghosh, and Doctor is presenting roadmap and opportunities of research in homeopathy for budding researchers and clinicians. That means for the 3 consecutive days we have a paper presentation on research. That's what we are lucky to have such a presentation in this forum, and to know much about research. And Professor Dharmendra Sharma sir has done a wonderful job in here. Sir, what's your opinion on the work done by your students in your column, and what is the present condition of number of admission in your colleges, and what is the trend there?
Our admissions are always full, sir.
Oh,
The
very good. Congrats.
first round always, for the last 23 years, we have not had a single seat vacant.
Oh, very good.
I'm the principal of that college since 99. We started the college in 2000. From 2000 to 2023, our seats are always full in the first round. Sir.
That itself show how effective and how
Yes, sir.
efficient you people are there, and how beautifully you are working for the system. And
Yes,
as you
sir.
rightly point out that there is a research wing with the full swing. That
Yes,
itself
yes.
indicate the beauty of your college and the power of your college.
Yes, sir.
Yeah, that anybody we need to send some of our students from this area or from different part of the world to your college to watch what is happening there. So also
Most
you
welcome,
can,
sir.
yes, you can also send your people to some of our institutes here in also in Kerala. We have a big pharmacy under government sector, I mean corporate sector, that is named as HOMGO, which has usually have 10 to 15 crores of uh, uh, rupees coming to the benefit of government.
I
That's it.
visited most of the colleges in Kerala. I've inspected most of the colleges, and I'm very well aware. I have got many good friends also in Kerala, and everybody is doing wonderful work.
Okay, sir. That's what is Kerala, because that's the reason why some people are challenging homeopathy here,
Yeah,
because
yeah.
all the nowadays people never believe that homeopathy has PG degree, MD. Now we have PhD.
Yeah.
You yourself itself is a PhD holder. That
Yeah.
means that that kind of changes that is
You
happening.
see, what I feel is that when you have your critics grow in number, that shows that your success is also growing. Because
Exactly.
because
Exactly.
nobody throws the stones to the barren trees. Always the trees which are full of fruits, people are throwing stones at them. So it's perfectly okay. Let them do their job. We should stick to our job.
Yeah, definitely. That's what that's what is the right point you shown in this forum, and exactly that's what is happening in here in Kerala. Anyway, we are very happy to have such a nice person to share your knowledge without any uh, uh, you are willing to share your knowledge as well as your understand with homeopathy. Hope we can have some more presentation in the future, sir, from
Sure,
you,
sir,
and
anytime.
you can bring some of your
Sahani sir is such a nice gentleman, and I always call him that he is the youngest person in homeopathy, and that is why he was very. I was very happy and very keen to be with him. So thank you very much, Sahani sir, also, and Danesh sir also for the kind words. Thank you.
yes. And now we invite students Sridhar sir to say vote of thanks to the Sridhar sir. Yes, sir. Please unmute, sir.
Sir, your session was extremely, I can say there is no, I am excited with that your presentation, sir. That this is the need of the hour that I feel. Sir, come again with such wonderful presentations and evidence-based, and also if it is needed, the fundamental research also you please bring. We are waiting for that. And in behalf of to the homeopathic fraternity, especially with the IFPH and the it is not only doctors, it is the lovers and the students and so many others. In behalf of them, from our hearts, that we are telling you a big salute and a big thanks. Thank you very much, sir. Thank you.
Thank you, sir. Thank you, sir.
Wish you all the best. Have a
Thank you,
nice
sir.
time and have a new year with prosperity and new research. Thank you.
Thank you, sir. Thank you, sir.
Okay.
With that, we come to the end of the day 1112, and tomorrow we will have another presentation on research work. With that, we come up the end of this day. It is over to Dr. Shaila to moderate the Malayalam session. Thank you all.
Thank you, Dr. Dhanesh. Thank you all.